tissue, that is hemoglobin. 5% of the iron is present in the myoglobin, and 15% of the iron is present in the form of the ferritin. 75% of the iron present in hemoglobin, 5% in the myoglobin, and 15% of the iron present in the ferritin form. The normal concentration, that is a 2.3 grams of the iron present in the female's body and 3.8 grams of the iron present in the male's body. This is about the iron introduction. It is the fourth common element on the earth. It is the fourth common element on the earth. 2.3 to 3.8 grams of the total 70 kg of the adult man, containing the whole body weight. 70% of the iron present in the blood and rest in the liver, bone marrow, and muscles. All these 100% iron present in 75% of iron present in the hemoglobin. 5% iron is located in the myoglobin for the from functional point of view, and 15% present in the ferritin. From functional point of view, this is the distribution. Upper is the distribution: blood, liver, bone marrow, and muscles. But this is from functional point of view: 75% of iron in hemoglobin, 5% of the iron in myoglobin, and 15% in the ferritin form. Sources of the iron: two types of the sources: exogenous source and endogenous source. Exogenous source of the iron is further divided into two portions: animal sources and plant sources. What are the animal sources of the iron? That are the meat, fish, liver, spleen, and red marrow. These are the animal sources of the iron. Plant sources: pulses, legumes, cereals, and nuts contain a good amount of the iron. Endogenous source means the iron utilized or metabolized or synthesized inside the body. The iron is utilized from the ferritin. The iron is synthesized from the ferritin inside by the different metabolic reaction. This is known as the endogenous source. Exogenous means a source from outside comes from outside. Endogenous, the source developed inside. These are the endogenous. Iron is utilized or iron is metabolized from the ferritin due to different metabolic reaction, due to hemoglobin metabolic reaction. This iron formation from that is known as the endogenous source of the iron. Animal source, that are the meat, fish, liver, spleen, and red marrow, and plant sources, that are the pulses, legumes, cereals, and nuts. RDA, daily required allowances of the iron, is depend upon the age, sex, weight, and state of the health. 4 parameters. Daily required allowance is not usually is a universal. It is depend upon the age. बच्चों के अंदर daily required allowance क्या है, old age के अंदर क्या है, males के अंदर depend upon the sex, either the different quantity, variable quantities required during in the males and females, weight point of view, and state of the health point of view. In the males, the daily required allowance of the iron, that is iron daily required, that is 10 to 15 milligram per day. In the males, required 10 to 15 milligram per day. In the females, 20 milligram per day. During pregnancy, pregnant ladies required more quantity of the iron, especially in the second and third trimester, 25 to 30 milligram per day. Iron is contraindicated or should not be given in the first trimester of the pregnancy, only the folic acid. Iron therapies start in the second trimester and third trimester of the pregnancy. Lactating mothers also require 30 milligram per day. Children require 10 to 15 milligram per day. These are the daily required allowances of the iron for the humans at different age group, at different sex group, from weight point of view and state of the health point of view. Serum level: 14.5 grams per 100 milliliters of blood. Range, that is 11.5 to 13.5 in the females and 11.5 to 14.5 in the males. The normal generalized iron serum value, serum level of the iron, that is 14.5 grams per 100 liter of the blood. But it is a range from, that is in the males and the females difference. In the females, it range from 11.5 to 13.5 and the males 11.5 to 14.5. Distribution: iron present in two forms in human body. Number one is essential, known as a functional, and number second, that is a storage form. Iron present, these points are important for your BCQ's point of view. Iron present in the two forms of the human body, either the essential, known as the functional, number second, that is a storage. essential part further divided into three groups. Functional part of the iron present in human body further divided into three groups. Number one, essential parts of the iron. Number one, that is a heme protein. Number second, the cytochrome. And number third, enzyme required the iron. Essential part are the functional part. Essential part are the functional part of the iron further divided, classified into three groups. Number one is a heme protein. Number second is a cytochromes. And number third, enzyme dependent upon the iron. Heme protein, four important heme protein: hemoglobin, myoglobin, catalysis, and peroxidases. These are the four important heme protein distributed or derived from the iron distributed. Functional point of view, heme protein, four important heme protein: hemoglobin, myoglobin, catalysis. What is the function of the catalysis? It destroys hydrogen peroxide. What is the function? What is the peroxidase? It is a typically plant enzyme. Peroxidase enzyme is typically a plant enzyme, is originated from plant, but this enzyme also found in the milk, erythrocyte, leukocyte, and lens fiber of the animals. Milk, erythrocyte, leukocyte, and lens fiber. Peroxidase commonly synthesized or commonly obtained from the plants. But this enzyme, peroxidase enzyme, it is a heme protein, type of the heme protein in the enzymatic form. It is found in the four important locations of the animal species: milk, erythrocyte, leukocyte, and lens fiber. Number second, that is the cytochromes. Number third, iron enzymes. Enzymes which are dependent, which use iron as a cofactor, iron as a cofactor, coenzyme. Those enzymes which are purely dependent upon the iron synthesis or iron concentration. Write down these names because these enzyme names important from your examination point of view. Which enzymes depend upon the copper, which enzymes depend upon the magnesium, which enzyme depend upon the zinc, and which enzyme depend upon the iron. Four minerals. आपके सिलेबस में continuously वो different modules के हिसाब से आएगा, but there are four important minerals: copper, zinc, magnesium, and iron. From enzymatic dependency point of view, xanthine oxidase, cytochrome C reductase, acyl co-dehydrogenase, NADH reductase. NADH reductase के तीन और enzyme, first four enzymes are commonly major enzyme dependent. Minor enzyme, these are the three tick-line enzyme. Last three enzymes: succinate dehydrogenase, aconitase, and ribonucleotide reductase. These seven enzymes depend upon the iron as a coenzyme or cofactor. Four major and three minor: xanthine oxidase, cytochrome C reductase, acyl co-dehydrogenase, and not acyl co-dehydrogenase. There is a acyl CoA, a typing mistake. Acyl CoA, capital A, dehydrogenase, NADH reductase. These are the major enzymes. Succinate dehydrogenase, aconitase, and ribonucleotide reductase. These are the minor enzymes. Storage form. In iron storage form, there are two important forms: ferritin, it is iron storage form, and hemosiderin. Metabolism. Absorption of the iron occur at the proximal part of the duodenum. Proximal part of the duodenum. Absorption of the iron occur at the proximal part of the duodenum. Which factors which increase the metabolism? Which factors would decrease the absorption? Presence of the vitamin C, glutathione, eating of the meat, fish, and alkaline medium of the duodenum. These five factors increase the rate of the absorption of the iron at the proximal duodenum. Five important factors: presence of the vitamin C, like citrus fruits, tablets, multivitamin tablets would contain a good amount of the vitamin C. Presence of the glutathione, eating of the meat and fish, alkaline medium of the duodenum will increase the rate of the absorption of the iron at the proximal duodenum. Eating of the tea, prawns, phytate compounds, coffee, acidic medium, and healthy state, normal healthy people, also decrease these factors, T, prawn, phytate, these are the carbohydrate derivative compounds, phytate. You can learn about that from the internet. You go ahead and teach what are the phytates, what are the function of phytates. It does not issue. Tea, prawn, phytate, taking of coffee, acidic medium of the duodenum, and healthy state of the human, they decrease the rate of the absorption of the iron. Functions of iron in human body. Number first important function of the iron in human body, transportation of oxygen with hemoglobin. Iron is responsible for the transportation of oxygen with hemoglobin. Iron electron help in the electron transfer reaction, including oxidative phosphorylation. Oxidative phosphorylation, it is a metabolic pathway. It is a metabolic reaction in which electron transfer from one end to the other end. Oxidative phosphorylation occur or electron transfer reaction occur in the respiratory chain reaction. Iron is a basic component for the reaction, that is electron transfer reaction, including oxidative phosphorylation. Iron also responsible for the synthesis or take part in the synthesis of the DNA ribonucleotide reductase enzyme. It is an enzyme which catalyzes the reaction, which catalyzes a one step of synthesis of DNA. This ribonucleotide reductase enzyme is dependent upon the iron concentration. How iron take part in the synthesis of the DNA? Iron take part in the synthesis of the DNA. In the cycle of the synthesis of the DNA, there is a one step which depend upon the ribonucleotide reductase enzyme. Ribonucleotide reductase enzyme, the activity or inactivity is depend upon the presence or absence of the iron. That's why iron take part in the synthesis of the DNA. Iron also take part in the decomposition of the harmful component of oxygen, peroxide and superoxide, because cytochromes, for example, catalase and peroxidase, these enzymes take part in the decomposition of the harmful components of the oxygen, supraradicals, free radicals. They remove the free radicals. These enzymes dependent upon the iron. Iron also take part in the fixation of the nitrogen and hydrogen molecules. Fixation of the nitrogen and hydrogen molecule, decomposition of the harmful component, synthesis of the DNA, electron transfer reaction, transportation of the oxygen with hemoglobin. These are the functions of the iron in human body. Clinical biochemistry, iron deficiency. Iron deficiency, there are two important clinical conditions, either iron deficiency or iron overloading. Iron deficiency in which the hypochromic microcytic anemia will occur. Hypochromic microcytic anemia. This line is important for BCQ point of view. In iron deficiency, which type of the anemia will be occur? Hypochromic microcytic anemia. What is hypochromic? What is microcytic? I hopefully that this topic has been done by the physiology and pathology department. There is no need to express what is hypochromic and microcytic anemia. In the iron deficiency anemia, in iron deficiency, there is a hypochromic microcytic anemia. When iron deficiency occur, hemoglobin concentration, serum ferritin level, and transferrin level will be reduced in the blood. Three parameters will be reduced: hemoglobin, concentration, serum ferritin, and transferrin. What are the causes of the iron deficiency anemia? Nutritional deficiency of iron, most common in Asian countries. Hookworm infection, repeated pregnancies, saal pe, do saal pe, continuously pregnancy 4, 5, 6, 7. It will reduce down the iron overload and causes the iron deficiency. Chronic blood loss. कोई इंजरी हो गई, सर्जरी हो रही है, फॉर एग्जांपल कोई इंटेस्टाइन के अंदर इन्फेक्शन हो गया है, वो लीक आउट कर रहा है, स्टूल के अंदर कंटिन्यूअसली ब्लड आ रहा है काफी दिनों से, इट इज क्रोनिक ब्लड लॉस. रोड ट्रैफिक एक्सीडेंट हो गया, acute blood loss. Maybe there is iron deficiency anemia, lack of the absorption. Iron does not absorb properly due to any reason, lack of the absorption, and lead poisoning. These are the causes of the iron deficiency anemia. For example, BCQ will come. Iron deficiency anemia, which is the most commonest cause of the iron deficiency anemia in Asian countries. The best answer, nutritional deficiency of iron. Nutritional deficiency of iron, which is the best or commonest cause of the iron deficiency anemia in the childhood, in the children's. That what will be your answer? Hookworm infection. Hookworm infections are the common feature of the children, because we continuously, बच्चे जो continuously taking a chewing gum, toffees, chips, etc., it will create a hookworms at the large intestine and small intestine. They continuously suck your iron and hemoglobin inside the body and will causes the iron deficiency anemia, that is hypochromic microcytic anemia. These two important BCQ. In the adults or Asian population, commonest cause, nutritional deficiency of iron. In the children, hookworm infection. In the female, married female, commonest cause, either nutritional deficiency or repeated pregnancy. So these are the factors. Number second condition, iron overload, means excesses of iron. What are the causes of the iron overload? Excessive absorption. Absorption of iron more than normal. Parenteral iron therapy. What do you mean by the parenteral? Parenteral, it is the intravenous administration of the iron therapy. किसी बंदे को ड्रिप्स लग रही हैं, उसके अंदर आप इंजेक्शन आती है हमारी माल्टोफर, वीनोफर, कंटेन आयरन. पेरेंटल थेरापी मींस आईवी ड्रिप्स के थ्रू हम इंजेक्शंस दे रहे हैं, आईवी थेरापी दे रहे हैं. इट विल कॉजेज द ओवरलोड. इट विल कॉजेज द ओवरलोड. And repeated blood transfusion also causes the iron overload. Two important clinical conditions, hemochromatosis and hemosiderosis. Hemochromatosis and hemosiderosis, these are the both clinical conditions of iron overload. Causes excessive absorption, parenteral iron therapy, repeated blood transfusion. Now hemochromatosis. Two types of the hemochromatosis, primary and secondary. Primary hemochromatosis, it is an idiopathic in nature. What do you mean by the idiopathic? Idiopathic means cause is not known. No cause. The cause is still not known. Inherited primary hemochromatosis, it is an inherited disorder, autosomal recessive disorder. Massive accumulation of the iron and hemosiderin occur at the viscera, especially liver and skin. Deposition of the iron in myocardium causes the cardiomyopathy and heart failure. In the hemochromatosis, there is a chance of the development of the diabetes, and the type of that diabetes known as the Brown's diabetes. Brown's diabetes. What is Brown's diabetes? Diabetes occur due to the iron overload, or diabetes occur in the patient of the primary hemochromatosis. Simple definition. What is Brown's diabetes? Diabetes developed in the patient of the primary hemochromatosis is known as the Brown's diabetes. What do you mean? What is the triangle of the Brown's diabetes? What are the clinical features? Three important clinical features: cirrhosis of the liver, heart failure, and diabetes, heart problem, cirrhosis of the liver and diabetes. These clinically combinedly known as the Brown's diabetes. C for the cirrhosis of the liver, H for the cardiac problem or heart problem, and D for the diabetes. So this is about the primary. Primary, it is the idiopathic, cause is not known, inherited, autosomal recessive disorder. Massive accumulation of the iron and hemosiderin occur at two sides, liver and skin, and number third side, that is myocardium. When deposition of iron, complicated cases, deposition of iron occur at the myocardium causes the cardiomyopathy and heart failure. Secondary hemochromatosis causes is known three important causes: defective erythropoiesis, hepatocellular necrosis, and cirrhosis. Secondary hemochromatosis, iron overload, defective erythropoiesis in like thalassemia, repeated blood transfusion, and patients with hemodialysis. The patient which are done the hemodialysis are the more prone to the secondary hemochromatosis, repeated blood transfusion, and defective erythropoiesis. Hepatocellular necrosis of the liver is common in secondary hemochromatosis. Cirrhosis is uncommon in the secondary hemochromatosis. The main From liver point of view, clinical feature of the liver, hepatological point of view, there is a difference between the primary and secondary hemochromatosis. In primary hemochromatosis, cirrhosis is common. In the secondary hemochromatosis, cirrhosis is uncommon. Mind this thing. In the secondary hemochromatosis, cirrhosis is uncommon. In the primary hemochromatosis, cirrhosis is common. This is about the hemochromatosis. Now hemosiderosis, last slides of today's lecture. Excesses of iron called axis of iron is called hemosiderosis. Golden brown pigments seen in the spleen and the liver. Complexes of the denatured ferritin, Persian blue reaction is positive. Hemosiderosis and hemochromatosis. On the laboratory point of view, what is the difference? The main difference between the hemochromatosis and hemosiderosis, Persian blue reaction is negative for the hemochromatosis. Persian blue reaction is positive in the hemosiderosis case. What are the causes? The repeated blood transfusion, like in the patient of the hemophilia, is the main cause of the hemosiderosis. Two important organs affected in the hemosiderosis. Number one is the spleen and number second is the liver. In the hemochromatosis, organ affected, that is the liver, that is your liver, that is myocardium and skin. So this is about the iron. First of all, you discuss about the iron के टॉपिक को पढ़ने के लिए आप अपने पास ये चार्ट जरूर रखिए बेटा. इंट्रोडक्शन, आपके जहन में चीजें आएंगी. वेयर इज आयरन इज फोर्थ कॉमन एलिमेंट, व्हाट इज द डिस्ट्रीब्यूशन, आयरन की लोकेशन कहाँ पे, आयरन की डिस्ट्रीब्यूशन कौन से बॉडी के ऑर्गन्स में, ब्लड, लिवर, बोन मैरो एंड मसल्स. From functional point of view, iron की distribution 75% iron in hemoglobin, 5% in myoglobin and 15% in ferritin. Sources, two sources, exogenous and endogenous. Exogenous, animal or plant, meat, fish, liver, spleen, red marrow, plant pulses, legumes, cereals and nuts. Endogenous, the source developed from inside the body, synthesized, metabolized, utilized from the body. Iron utilized from the ferritin inside different metabolic reaction. It is the endogenous source. Then daily required allowance, it depend upon the age, sex, weight, whatsoever we already discussed. Serum level 14.5 grams per 100 milliliter of blood, but its range 11.5 to 13.5, 11.5 to 14.5, male and female. Distribution of the present in two form, essential and for storage. Essential, that is the functional. Essential further divided into three portions: heme protein, cytochrome and enzyme. Heme protein, what are the examples? What are the forms of heme protein? Hemoglobin, myoglobin, catalase and peroxidase. Cytochrome, iron dependent enzyme, 4 important, that are the major, 3 are the minor, already discussed. Storage form, that is a ferritin and hemosiderin. Metabolism, iron metabolized at proximal part of the duodenum. Which factors increase, which factor decrease? Vitamin C, glutathione, meat, fish alkaline medium. Tea, plant, phytate, coffee, acidic medium, healthy state, decrease the metabolic, decrease the absorption. Then functions, transportation of oxygen, electron transfer reaction, synthesis of DNA, decomposition of harmful compound, fixation of nitrogen and hydrogen. Iron deficiency, either excesses. Deficiency, hypochromic microcytic anemia. Causes, discuss in detail. Iron overload, 2 clinical condition. What are the causes of iron overload? Excess absorption, parenteral iron therapy, repeated blood transfusion. 2 types, hemochromatosis, hemosiderosis. What are the difference? In the hemochromatosis, organs involve liver, skin and myocardium. In the hemosiderosis, organ involve spleen and liver. Persian blue reaction is positive for the hemosiderosis. Persian blue reaction is negative for the hemochromatosis. Cirrhosis is common in hemochromatosis. Cirrhosis is uncommon in hemosiderosis. This is about the iron metabolism. Tomorrow, inshallah, we will discuss regarding the beta fats, vitamin B9 and vitamin B12, folic acid and cobalamin.